Today's session, as a reminder, is yes to, if you would advance me, please, yes to partnerships for youth behavioral health. We have two incredible presenters with us today, and I'm very excited to introduce them. So if you wouldn't mind, on our next slide, I have a few things to say about our first presenter, Christine, and Adrian as well. So let me start with Adrian. You'll see Adrian on the left-hand side there. Adrian is the Vice President of Public Policy and Strategy at the California Alliance of Child and Family Services and the Catalyst Center, overseeing the work of the policy team. She is a recognized expert in mental health policy who has devoted her career to improving the well-being of people living with brain illness and substance use disorders. Welcome, Adrian. And our first presenter, who will be Christine Stoner-Mertz, is a licensed clinical social worker, is also the CEO of the California Alliance of Child and Family Services and its Catalyst Center. As a practitioner, administrator, advocate, and former foster parent, Ms. Stoner-Mertz brings her personal and professional expertise to the policy and practice efforts of the Alliance and Catalyst, a training and technical assistance program focused on practice improvement in children and family services. Representing member organizations providing behavioral health, child welfare, and education services, she helps to ensure that policy reflects the needs of provider organizations and those that they serve. And with that, we want to say welcome and good morning, Christine and Adrian. We're super excited for today's session. And Christine, I believe you are going to kick us off.
That I am. Thank you so much. Really appreciate it, Jessica. Good morning, everyone. Hope everyone's doing great. I think we doing our poll first to get a sense of where people's background is?
We can totally do that.
That would be great. We want to make sure that we're addressing your needs through this presentation. So tell us where you're joining from so we get a sense of who we have in the room. And you could advance to the next slide, actually. Jessica did a great job of describing the work that we do. This is just a little bit more detail. Lots of CBOs. Okay, great. Lots of information about what we do and provide, and we can also make sure you get information about both our websites, the California Alliance of Child and Family Services and our Catalyst Center. We have 160 plus member organizations that we advocate for in Sacramento. And as Jessica said, we do a lot of work on training and technical assistance as well. So we're really happy to partner with Caltrin. Next slide. Many of you, I'm sure, have heard at least a little bit about many of these initiatives that are happening in our world across the state and locally that are impacting the work that you all do with children, youth, and families, whether you're a county agency staff, a state person, or a community-based organization staff member. These are just really sort of four buckets that give you an idea of what all has been happening over the course of several years and continues really through 2027 for many of these initiatives. Most particularly, though, the first and second items are the ones that we're going to focus on today. And you'll find that some of these slides are very dense. We really want you to ask questions. I know this isn't a webinar format, but both Adrian and I are much more used to, having audience participation and engagement. So we really welcome any questions, and we'll try to make sure we either answer them in the Q&A and or live. So please do that. All right, next slide, please. So the CYBHI, or the Children and Youth Behavioral Health Initiative, is an initiative that was in the 2021 state budget and goes until 2026. It is part of a larger plan that the governor has called the Master Plan for Kids' Mental Health. And there's a link here in the slides. And of course, you're going to get these slides at the end of the presentation. And I'm sure they'll also be put on the website. So it is a 5-year initiative. There are 14 work streams, which you're going to see on one of the next slides. And there are a number of goals around the CYBHI. It is to improve children and youth behavioral health and well-being, to improve access to and experience with those services, and in particular to really focus on equity and making behavioral health services, going beyond the traditional behavioral health services that many of us think of. Additionally, there's a focus on improving system level support and collaboration. So getting both state and local agencies to really work together to address children's behavioral health, and expand and diversify the behavioral health workforce. So, and we also have a link there. There is a website that has just an enormous amount of information if you want to learn a lot more about the CYBHI. Next slide, please. So this is just a visual of the CYBHI work streams. We're going to touch on just a few of these. And many of them are at different stages. So a lot of the funding associated with the CYBHI is what's considered one time. And a good amount of these funds have already gone out. Hopefully, some of you on the meeting have actually gotten some grants or gotten support through some of the different funding that's been available through the CYBHI. We're not going to go in depth into all of these that are highlighted, but these are the areas that many community-based organizations, counties are really focused on in terms of both implementation and potential new funding on a one-time basis. So in particular, there's a real focus on workforce. We could do a whole webinar on wellness coaches, but many CBOs and also schools and county offices of ed have received grants to really develop this new type of provider that supports work in schools. We won't be talking a lot about that, but when Adrian talks about the fee schedule, that's one of the providers that can support children through that fee schedule. We will be delving deeper into the fee schedule so that you all can learn a little bit about that. And if you aren't already engaged with schools, you should be. We're going to talk a little bit more about the dyadic benefits and some of the EBPs, or the evidence-based practices, as well. So, but this just gives you a bit of an overview. And one of the things we're really excited about at the Catalyst Center, and I think we have our director on the call, if I saw the chat correctly. We have, through our Catalyst Center, gotten a grant to develop a prevention program that it is a training program for adults who work with youth on substance use prevention. It is called Open Doors. It is not yet actually happening because we are in the development stage of the curriculum, but we are partnering with the California Alcohol and Drug program administrators on this program, as well as the National Council for Mental Wellbeing. So more to come on that for sure. I think that's it on this slide, and we can jump to the next. Thanks, Tia. So one of the reasons we wanted to do this presentation was to really be able to talk about how do CBOs fit into this sort of ecosystem of the CYBHI, and also with the BH Connect waiver that DHCS has developed and is in the process of waiting to get approved by the Center for Medicaid and Medicare. Here are just a few ways. There are workforce grants and workforce initiatives through the CYBHI. There have been scholarships for professionals. If you have not already gone to the Healthcare Access and Information website, or HCI, you should take a look at what's there. It's not just for organizations, but it is for individual professionals as well in terms of getting scholarships. Engagement in the fee schedule. If you are already a school-based provider, you should be talking to your schools that you work with about how that's getting implemented. Not every school is doing it yet. There's a wave, and Adrian will talk a little bit about that. But this is a way to make sure that you are either expanding or developing new types of supports to children in schools, because that really is a big piece of the CYBHI. It's all about getting services to children where they are. Dyadic services, which really hasn't gotten quite as much, I think, emphasis as it should, is really a focus. This is a new service level that can now be provided through Medi-Cal. And it really is a focus for children 0 to 5 and their parents to do work together, to do counseling or therapy together. So it is a new way of billing for services and providing services that has been very difficult. If you're a first 5 provider or are doing services with young children and their parents, you've probably struggled to figure out how do I bill those services. This is a way to make sure you can. Even though the services are primarily for the adult, you're really helping them. And this new billing code allows you to do that. And then finally, evidence-based programs. I know we've got a few providers on this call who have gotten grants to do evidence-based services. Those have all been now, I think, determined. So there aren't new opportunities for that. But again, there's going to be continued ways of billing for these evidence-based programs that we'll talk about when we talk about BH Connect. So I think, next slide, please. I think this is where I turn it over to Adrian.
Thanks, Chris, and a good morning to all of you. It's great to see some familiar names in the participant list. Shout out to hello, California Alliance members. I see a number of you. So as Chris mentioned, I'll be giving some basics about the multi-payer fee schedule for starters, which is something that we're really excited about because really see some potential for community-based organizations to expand work or even begin work in partnership with schools to support our kids. This is really about, big picture, increasing access to school-based behavioral health supports across, the big vision is across all schools in California and creating a sustainable way to do that. So we're starting here on this slide with just some of the fee schedule basics, but specifically looking at payment financing. So the fee schedule establishes the minimum rates that the plans, which include health plans and Medi-Cal managed care plans, must reimburse the schools and or schooling providers, aka community-based organizations, for the provision of services at a school site. So what you see on the screen here is just a snapshot of the billing guide that's posted on the DHCS website, but we also included a link to this on our resource sheet. I wanted to make sure you had that, but it includes the appropriate billing codes, the rates, the provider types for each of the services, that's billable as part of the fee schedule program. This is a draft. It is posted, but DHCS is still awaiting approval from CMS, so it potentially would be updated, but this gives you a pretty good sense of financing for the program. So on the next slide, we're talking about the goals for the program that DHCS has outlined. And they are big ones, as you see, including number 1, which is this, again, this is about increasing access to school-linked behavioral health services for children and youth. As you probably all know, doing this work across the state, that it's currently very uneven in terms of access to these types of supports and services, on school campuses across the state. So depending on where you are, where the student is, that can change. And so this program aims to change that. Like we really do want to provide these types of services everywhere for the students who need them. And community-based organizations have been doing this work for many years. And many of our California Alliance members are partnering with schools even before the fee schedule. And now under the fee schedule, there are more opportunities because schools are really a hub now to leverage this program. And on the next slide, there's another aspect of this program we wanted to talk about in terms of the details. So within this program, there is what is called a third-party administrator. That's the TPA acronym you might see. That's what that stands for. DHCS has contracted with Carillon Behavioral Health, and they are going to serve as essentially the statewide clearinghouse for claims management and for payments. And so we've on this slide here have sort of the vision for how this will work or how this flows. So services are provided either by the LEA, by the school, or by the provider, the schooling provider, then reviewed by the school, and then submitted to Carillon for processing with the children, the youth's insurance. Again, that could be Medi-Cal or it could be private, as we mentioned earlier. And then the plans are required to pay based on those rates that we had talked about earlier that are published. So we are early in this program's development. It's basically, this is a new program that really just started over the last year. Chris mentioned the phase-in. So there are currently 2 cohorts of LEAs that have been selected. And the second cohort of 94 schools, by the way, was just announced recently. So that second cohort really technically doesn't go live. My understanding, I'm talking with Carillon yesterday, they don't go live until October 1st. So really we just have the first cohort that has opted in. That's about 50 LEAs. So it's a small program right now. DHCS has been talking about and holding webinars about the cohorts 3 and 4. There's currently an open application process for potential cohort 3 LEAs. So schools have to apply to opt in, and you actually can view the application that they submit on the DHCS website if anyone was interested to see like what schools have to put together to participate in this program. And so the other couple of links that might be of interest to our audience that I included on the resource sheet was the links in the list of the specific LEAs in cohort 1 and cohort 2. So you can actually see if a school in your area has submitted and been approved to participate. And many of these schools are working with our members, are working with community-based organizations, designating CBOs, often in partnership with school staff, to be, division to be providing these services and supporting our students. So, and that provider designation is very important, because the way that a CBO would be able to participate is that the LEA, the school, needs to designate you. Like, there needs to be a relationship and a contract. And those conversations can begin now. The designated provider list can be updated over time. We have confirmed that with DHCS. So, like, for example, if an LEA in cohort 1 didn't initially include a community-based organization on their sort of list of partners, that can be updated. So there is still lots of time to be thinking about this. If there are CBOs on this call that are not engaged or are interested in being engaged with schools, there is still a lot of time to be thinking about, being a partner in this effort. So I think we'll go into next slide. Yeah, we just have a couple of slides just with, again, some basics about both the youth who are eligible, and then the following slide is about agencies who are eligible, which I sort of got into a little bit on that last slide. But just to outline here, the youth, students ages 25 or younger who are covered by Medi-Cal managed care plans, Medi-Cal fee-for-service, commercial health plans, or disability insurers are all eligible for this program. And then we have the column here about like specific call outs about who is not eligible. So there are some groups of students who would not be, which we have included there. I did want to call attention to one of the bullets, because this has come up with Alliance members about special ed and students with IEPs. So they are eligible, but they're only ineligible if the services are listed on their IEP. But they're eligible for other services under the fee schedule. Many of our community-based organizations in our network are working within special education. So that, I think, is just an important call out to clarify that. And then on the next slide, we're talking about the agency eligibility. So again, the provider, the community-based organization, must be a designated provider by the LEA under the fee schedule in order to be a participant. And this can happen with relationships between schools and providers. I see organizations on this call that are working within the fee schedule or beginning to, so would love, if anybody would like to share an example, would love to hear that later. And so we could highlight that. And then the services can be provided at the school site, including on campus or off campus or mobile clinic locations. So that is in the policy guide for this program in terms of where the services are offered as well. The next slide. So this is staffing. Probably looks very familiar to those of you who are doing the work, or who worked within public behavioral health. These are, our staffing structure, licensed, mental health professionals, doctors, also the personnel services, or PPS, credentialed staff within the school campus are eligible. And then a few other classifications too to mention, including community health workers and the wellness coach, which we are looking forward to see the next round of guidance on this program to hopefully specifically call out the wellness coach very specifically in the staffing arrangements and the rates for that. So that's something we at the Alliance have been advocating for. Many of our members, and would love to also hear from organizations on the call, are hiring wellness coaches, or there was an opportunity through HCI to be an employer support, to actually get a grant for employer support for wellness coaches specifically. And we had 6 members in our network, at least, were awarded for that. So there's a lot of interest in that wellness coach as part of the staffing that exists for the fee schedule. So that's in progress. Next slide. So now we're just talking about, so what are the services under this fee schedule? Well, primarily it's outpatient mental health and substance use disorder services. And the services, just to boil it down, under the fee schedule really fall within 4 categories, which I've listed on the following slide. So it's psychoeducation, screening and assessment, therapy, and case management. And so on the next slide, we kind of go into more details about that. And there are more details in the DHCS policy guide, which we have linked on our research sheet as well to have some more details, but just wanted to sort of put the top line information here for you in terms of what are the services. So we can go
Adrian,
to...
can I pop in and ask you a
Yeah,
question
please.
that's in the chat that has come up? Can you remind us if ASWs, so those getting their hours,
Yes.
or LCSW, are eligible to bill to the fee schedule?
They absolutely are. Associates are eligible. So that's across all of the professions, ASW, MFTs, and counselors. So the associates are absolutely included. That was a welcome news to us, as that's absolutely part of our staffing and public behavioral health. Great question. So again, those are what I just had reviewed in terms of the kind of general categories of services under the fee schedule. And the next slide, I promise we're almost getting through this, and then we'll move on to the next initiative. There are a lot of pieces to this one, and we're excited to be part of it. So this slide again is just kind of a wrap up again of the rates. This is important. So you really want to look at that rates worksheet that we included in the link, because that sets the minimum rates that the plans will reimburse schools and the providers for the provision of these services. And I think let's see if I was going to mention anything else on this slide. Yeah, these rates are essentially aligned with the non-specialty mental health rates. So you won't see, they're lower than like the specialty mental health rates, because the services are not meant to be as intensive as those provided in specialty mental health. So that's sort of where the alignment comes in. We've had some questions about that among our members.
Adrian, I wonder if it might make sense before we sort of jump in. This is so much information we know, especially if you haven't already heard it. I want maybe just see if there's any questions out there. And by the way, thank you, Lisa Tadlock, for your comment. Any questions that folks have? You are not seeing the rates worksheet on the resource sheet. Okay, we will update that sheet, and we will also, I don't know, Adrian, if we can put that
I'll put it in the chat. I have it handy
as well. You could probably navigate to it. Oh, perfect. Thank you. That's great. Any other questions?
I was just looking at it prior to this call, so I had it handy on my...
Love it. Thanks, Tay, for that. Any other questions before we sort of pivot to talk about the BH Connect initiative?
Chris, there's actually a question about dyadic services and the rates for those. Is there a sense when the rate for dyadic services will be approved? I may need to ask.
That is a great question that I don't have the answer to. I know that, yeah, we need to find that out for you. We will, we'll find out when that is, if it isn't already determined, when that will be determined. That's a great question. Thanks. Sorry, we didn't have that ready for you. Let's see. Natalie's asking, a lot of our youth have inconsistent school attendance. Does this impact eligibility for linkage to services, or is enrollment in school enough?
It should not impact their eligibility, even if there's inconsistent attendance based on what, the eligibility criteria that DHCS has outlined. Great
And I
question.
know, Adrian, you mentioned this, but maybe it's worth saying again. The idea behind the CYBHI is that school linked services are available. So if there is a service that isn't available at a school site for one reason or another, for those of us who've done school-based programs, in one case, they set my organization, when I was a provider, up in a bathroom because there was simply no space. So you can be a provider even if you aren't physically on the campus. And it's why they actually focused it on not just school-based, but school-linked services. So hopefully that's helpful, Natalie, because a big issue for many students is attendance, right? Because of all of the things that are happening in their world. Right. And so this is supposed to be, again, a way for youth and families to get those services they need.
I wanted to just make a plug too about something we're working on that's related. That's a policy proposal right now. It's a legislative proposal that is almost to the governor, and it's around youth who, it's about supporting youth with substance use challenges specifically on school campuses, and not allowing the schools to suspend if the student voluntarily comes forward with an issue. What we don't want is, we're very concerned about trends and data around suspensions, expulsions of youth who may need that support the most. So we're setting up this amazing program, and we don't want to be kicking kids out who may need these supports the most. So we're also working on that. It's complementary policy work the Alliance is doing.
And also very much links with why we want to do training and prevention for substance use services. Yeah. Candy, you're asking, can you repeat what that is called? Are you talking about the bill?
Yes, happy to. I don't think I even said. So it is Assembly Bill 2711, and I will also put that link to the language in the chat right now.
And then Steve, hi Steve, asks, are you aware of CBOs successfully blending and braiding dollars in partnership with school districts? Did I get that question right? I know I didn't read it straight out, but hopefully I got it right.
We're aware of a lot. Oh, is that for me? We're aware of a lot of them. In fact, some are on this call. I see Seneca. Hey, Patty. Yes, we have a number of examples of that. Pacific Clinics is another example. They're actually participating in cohort 1 with some schools and are looking to do more in cohort 2 and beyond. There's a couple off the top of my head who are part of this webinar.
And right now, districts, have these one-time funds. It's obviously not necessarily going to be long-term funding to blend and braid, but to certainly get things started in partnership with them, they have some additional dollars. We're not even going into the community schools initiative, but there's funding there. There's expanded learning dollars that have been implemented and will be ongoing, many of them. So there are a lot, like I said at the beginning, there are so many initiatives. Some schools are actually, frankly, overwhelmed and almost don't know what to do with all the one-time funding. So if you haven't sat down and really talked to your districts or your county offices of ed, we really strongly urge you to do that and ask them about all of these initiatives. And certainly if anyone that's participating has questions or needs, you can always reach out to us through the Alliance or our Catalyst Center, and we're happy to point you in the direction that you might need. So Lisa is asking, how I'm really interested in
Hmm.
school services and how it connects with juvenile involved youth. Are schools coordinating with probation to coordinate funds?
That is a good question. I don't know the answer to that.
I might be able to help a little
yeah.
bit. I am aware of at least one county office that has gotten very focused with their CYBHI dollars and community schools dollars on how they target youth who are in the county day programs that they have. So these are students who have been expelled from their home school for one reason or another, and many of them are then involved in probation. So the part of it is, how does the county office, what are they focused on, right? They have a lot of flexibility with this initiative to determine how are they going to target the funds that they have. And so where one of the challenges with the CYBHI sort of on a broad level is to do it right, you have to have many partners. Probation's one of those. CBOs is another. The child welfare system, the behavioral health system, the managed care plans. We haven't even talked about them, but they've been brought in to really try to integrate both the funding and the services. So going to your local county office of ed and finding out, do they have someone that's leading the CYBHI initiative or the community schools initiative through the county office would be one way to begin to do that. So in short, Lisa, the answer is yes, there are examples of that. And I think it's very much a local decision about how they're doing that kind of outreach and engagement. But happy to talk offline about some examples where that is happening.
Chris, Lisa's question though makes me think I would love to know more about beyond, because we know about Alliance members that are partnering, but beyond that, how schools in the first cohort at least are partnering. And it might make sense for us to recommend that to DHCS for one of the advisory committees that we sit on. I'm thinking BHSAC. So I think it's a great question, Lisa.
Most definitely, yeah. Karina asked about repeating the initiatives. So there are many of them are listed on that first slide we went through, but there is the CYBHI, the Children and Youth Behavioral Health Initiative. There is the Community Schools Initiative. There is the initiative we're about to talk about, the Behavioral Health. I never get this right. Community-based community organized networks of equitable treatment. And I missed something in there that has a C, but we're gonna get to that. What other initiatives do we have out there? We did not even talk about foster care rate reform, which I'll bring up a little bit when we're talking about BH Connect, and the Family First Prevention Services Act implementation in California. So many things that are happening in terms of all of these initiatives, many of which have either one-time funding or some ongoing funding. So hopefully that answers your question, Karina. A thing for folks to know who are tuning in as well is that Adrienne and I have done a couple of other presentations for Caltrin. I want to say back in maybe April or May that delve into some of these other initiatives. So I really encourage you to go to their website and look at those, because the resource sheets are very full of lots of links and resources that you can find to learn more. But again, don't hesitate to also reach out to us. So, okay, I think we're ready to jump into the BH Connect initiative. And there it is, behavioral health, community-based, organized networks of equitable care, and treatment. This is an initiative of the Department of Healthcare Services. We have borrowed many of their slides, and you'll see they're quite dense. I will try to keep it somewhat high level as we walk through them. But you can go to the first slide. Thank you so much, Jennifer. The goal of this effort, and it really is what's called an 1115 waiver. So for those who maybe aren't knowledgeable about how the Medicaid or Medi-Cal in California system works, when you want to do something outside of the traditional approach to billing for Medicaid services, a state has to do a waiver. And so this package of programs, I guess, or services are part of a waiver that the state has put together and has actually now sent to the Center for Medicaid and Medicare for approval. So it's very early on. None of this has actually been implemented. But again, this is an opportunity, if you're a community-based organization or a county agency, to really learn what are the opportunities here that you would want to know about and potentially get involved in. The goal really is to build out a continuum of care for Medi-Cal members, not just children and youth, although that's our focus, who have significant behavioral health needs. And you can see here sort of the array of different services that BH Connect is trying to focus its attention on. You can go to the next slide, please. These are kind of the primary goals and objectives of and the approach that DHCS is using. They want to strengthen family-based supports for children in the child welfare system, and hopefully actually ensure that they can get services at home and or return home. There's a real focus here on expanding supports and services around employment, housing, etc. There is also a focus in this waiver. We will not get into the details of this, but there is funding in this waiver to support strengthening the workforce through both training and other supports, including centers of excellence. There is a focus on supporting those that are returning from being involved in the criminal justice system. There is also a focus on incentivizing outcome and performance improvement, and a lot of integration. You'll see a lot of this in these different components of the initiative, a lot of integration between behavioral health, child welfare, managed care plans. So some of the pieces of this initiative are sort of system level and aren't directly impacting or aren't direct opportunities necessarily for a community-based organization, but absolutely are going to have an impact on the broader system. So next slide, please. We're really going to focus on this, on pieces in this yellow box. This is a very big initiative that has lots of different components and parts, but we're really going to focus on these first areas that you see here. So, and Adrian, I don't know, maybe you could put the link to just the website.
Yeah, we'll do.
For BH Connect, so folks can see that too. Thanks. All right, next slide. So I talked a little bit about the Centers for Excellence, but let me say more about that. The idea is there's a real emphasis, and you saw this both in the CYBHI and probably in other initiatives. It's also a component of the Family First Prevention Services Act, evidence-based practices. It's specifically the BH Connect waiver is looking to take 3 different evidence-based practices and maybe more. MST, FFT, PCIT are the 3 that are focused on working with children and youth. And what this waiver will do is essentially create a way to bill for those services that will have a code specifically for them. So functional family therapy is one of those, FFT. Rather than today, you as a provider would be billing for pieces of FFT, individual therapy, family therapy, maybe case management. What the waiver will do is it will create one billing code for functional family therapy or parent-child interaction therapy. And so when you're doing any service that is associated with that program, you would simply use the billing code for that program. Hopefully that makes sense. There are lots of other either EBPs or other services here that are listed. Hopefully no one will do a quiz for me on all of these, but they are also listed on that BH Connect website. But the Centers for Excellence will, and we're actually awaiting finding out from DHCS who they have selected to provide these Centers for Excellence. We'll provide lots of training and support and technical assistance for individuals and organizations to implement all of these various different types of services that are part of BH Connect. Let me stop there and see if there's any questions, because I know this slide it's a lot of information. And Adrian, maybe you can also help me with some of the acronyms, which I frequently get confused about.
Chris, there's just one question that's come in so far in the chat. Are these billing codes for FFT still in draft?
Oh, yes. So with a waiver, which is what is creating this initiative, the state has to propose to the Center for Medicaid and Medicare what the whole program is. So you can actually find this also on that website. You can see the application that the state has put in and look at probably more detail than any of us really want to about that. And then they hear back from CMS as to what components they can do or can't do. And that's when they then start talking about the rates for these. So yes, that will be obviously a very important component because that determines, what you can and can't do often. So, all right. Any other questions before we move on? Okay, Jennifer, next slide. So another piece of the BH Connect waiver is the development of a cross-sector incentive program for children involved in child welfare. As I said, there are pieces of this waiver that are going to really impact sort of more system level. So I know we have maybe a few folks on from counties. We didn't ask about if we had managed care partners on, but this cross-sector incentive program will essentially provide funding for a county child welfare department with their behavioral health department and the managed care plans that are in that county to come together and make sure that if a child or a youth is engaged with one of those systems, they are all working closely together to make sure that those children are getting their behavioral health needs met. So lots of this, again, is still sort of in process, and DHCS is developing with constituent feedback. What are the types of things we would want to provide funding and incentive money to the county departments and the managed care plans to show that they're doing things together to make sure every child and youth that is part of the child welfare system is getting their behavioral health needs met. So it's, again, it's very high level right now, but it's also a very exciting thing to see the state essentially putting money behind getting these organizations to really work together on behalf of children. We have lots of silos. I know you all see them in your work. And I do think the state is trying to take some steps to improve that. And this is one of the ways they can do that. Okay, next slide. Actually, this is going to talk a little bit more about some of the things that they are looking at for ways to incentivize these groups to work together. I will not go into these details, but as an example, one of the outcomes might be a reduction in the average time for a child who is in foster care to get to permanency, right? If those organizations are all working well together and making sure that children and their families have the services they need, hopefully that means children move out of foster care faster. So that's just one example, but these are the types of things that they're looking at providing funding to support. Okay, any questions about the cross-center sector incentive program before I move on? It looks like we've got something maybe in the Q&A.
Oh yeah, Chris, I can see it.
Oh, great question, Gabby.
You see it, okay.
Do you want to answer that or you want me to?
No, go ahead. Just want to make sure you saw it.
Really what you can do as a CBO right now is talk to your child welfare department and your behavioral health department. Or if you're working with a managed care plan, say, hey, what are y'all doing around this effort? Because we want to be engaged. It is, again, because it's happening at the system level, you may not as a CBO necessarily be hearing this. It'll really be up to you to ask the questions and to say, hey, are you gonna participate in this? And how can we support you as a partner agency, etc. So, great question, though. Thanks. Next item. So another component of this initiative is what's called activity stipends. And the idea is, and it's in many ways very aligned with CDSS's rate reform proposal that emphasizes how do we support foster youth and get them the funding they need to be involved in activities that support them as individuals, right? Whether it's a leadership activity, a sports activity, music, art, etc., that we all know probably had a huge impact on our own lives as children and youth. It's oftentimes when children are system involved, that might be something that isn't attended to in the same way as you might attend to it with your own child. And so this is a way to really emphasize how important that is for children who are involved in the system. And again, Medi-Cal doesn't typically pay for these types of services, right? That is why this waiver is being implemented that allows CMS to say, well, this is an exception, but we are going to allow California for 5 years. Usually each waiver goes for five years, to see if there are positive outcomes for children in foster care if we support them getting funding for these activities. So I will say, when you look at California and what they've done in terms of kind of pushing the envelope around funding through Medicaid, they are in many ways ahead of most states. They're really trying to look for every opportunity to do non-traditional kinds of things through Medicaid funding, which is, I think, a very positive thing. So this has not been implemented. It's right now a vision document that's being reviewed by CMS. But another area where, if you're a CBO, talk to your child welfare department, ask them what they're thinking about, so that it is something that gets on the radar if they're not already aware of it. Okay, next slide. Another very important component of this waiver is aligning the use of the Children and Adolescent Needs and Strengths tool. If you're a CBO or a behavioral health staff, you are probably aware that when a child comes to you or comes to child welfare or is involved in the public behavioral health system, part of the assessment process is to do one of these assessments and use this tool. But for many years, there has been the way that behavioral health does it, and often every county chooses a different array of questions for the CANs, and child welfare similarly has, what they're using. The intent of doing this, and this actually doesn't need a waiver, this is much more of just a component of the initiative, is to get one CANs that looks the same across the systems, so that, and eventually the hope is to actually have that shared in a way that, regardless of where a child is being served first, that the results of that CANs is available to the counties and to the providers. There's nothing more frustrating than having to get assessed multiple times depending on where you're going to get a service. So the whole intent here is, again, to get these organizations, these agencies really working together to get the tool to look the same regardless of where you're getting the services in a system. And of course, for foster youth, this is critical because oftentimes foster youth may be moved from a program in one county to a program or a foster family in another county, or even to a relative in another county. So we want to do everything we can at a statewide level to make sure that the information that is critical to being able to provide the services to the children and youth is found wherever that child is. It looks like we've got a question in the chat. What is the bridge into adulthood for mental health? The disability is not covered under regional center. DOR. I am not sure what you're referencing there, Denise.
I think that's Department of Rehab, but
Okay.
I'm not sure exactly what that means. Right.
So, well, we could probably do a whole other webinar about the challenges for transition age youth. I'm sure we could, in fact. It is a real struggle in terms of, particularly if you're in the foster care system, transitioning into adulthood and ensuring that those services, particularly the behavioral health services, as well as housing supports, are available to you. This particular initiative does not, yes, we'll work on that, Denise. This particular initiative doesn't directly impact that, to be honest. It is much more focused on children in the child welfare system, but we have lots of projects at the Alliance and our Catalyst Center that are very much focused on that. So we'd love to talk to you more about that.
Chris, there's a question about waiver timeline in the Q&A to read here. Do states reapply every 5 years for the waiver if the outcomes are positive, or is there a different process for continued funding after the 5 years are up?
Well, you probably know this better than I do, Adrienne, but I would say it depends. The idea behind a demonstration project is that you are trying to demonstrate to CMS that this new way of doing things has the kinds of outcomes that you want. It's also a way for CMS to try to innovate, and we know how challenging that can be for government, and see, are there new ways of doing things? So Adrienne, what more would you have to say, though?
I think you covered, I mean, CMS, our federal government can put out, new demonstration opportunities. Depends sometimes on who the administration is in the state, in terms of like what, they're willing to back, right? Because the department under the administration, under that certain governor, applies. So there are like factors like that too, that determine whether or not, what waivers the state, sort of goes for. But yeah, CMS is tracking these, and there's a lot of conversation reporting, back and forth with our department and CMS as these are rolling out.
Thank you. Okay, next slide. There's kind of two more components we're going to talk about in the BH Connect. This is an initial joint behavioral health assessment, and again, focused on children who are at risk of or in the foster care system. DHCS is working with CDSS, Department of Social Services, to make sure that when a family is at risk, if there is some sort of an investigation based on a complaint that is made, that a behavioral health staff would, with the child welfare staff who is visiting the home, participate and be able to really assess what is happening. And again, the idea behind all of this is if you get families the interventions and supports and services that they need, we will keep more children out of foster care. So getting them, let's, for example, a family who is struggling, someone makes a CPS report because they think a child may have been subjected to abuse. A team goes out to meet with that family. They identify that a parent has a substance use issue, right? That might be hard for someone, a child welfare worker who maybe doesn't have the same expertise or background as a behavioral health person does. But together, they may identify, here's what the family needs. And then perhaps rather than simply pulling a child out of that home, you can say to the family, we want to get you the help and support you need. Here's what we think we can do for that through the behavioral health care system. Whereas before this initiative, there are really difficult challenges and kind of just basically a lack of communication, not anyone's fault, just that systems work very independently. And so it might take many months before you even get a referral to the behavioral health department for a parent. So this is one way, again, up front to really get those systems working together so that families can get services as soon as possible and keep kids in their homes. Then finally, next slide, please. The foster care liaison role is a role actually that will be played under the managed care plans or the health plans, i.e. Kaiser, HealthNet, those organizations that are providing health services to children and their families who are Medi-Cal beneficiaries. And they are required to hire on or contract for someone that is identified as a foster care liaison, so that managed care plans now are really connecting to families that have foster care involvement. Again, all of this goes back to that broader goal of our systems need to be working together on behalf of children, youth, and their families to keep them out of systems, to keep them together, to get them the services they need. And if they are system involved or need to be system involved, that is for a shorter period of time. And we're giving them the supports and services they need to return home or be together. Historically, health plans have really not, outside of a child going to their primary care doctor, they really have not been integrated through the behavioral health services that they can provide and are required to provide to these children. So this is really a new thing for health plans over the course of the last several years, and there's still much more integration to be done. So, but this is one of the key pieces that they've put in place in hopes that they're really pushing the systems to work together. Okay, I promise we're almost done. We want to make sure there's a little bit more time for Q&A. We're gonna one of the things we put this together to really show you, if you think about how these different programs are trying to work together and that the state is trying to pull them together. This is just one example. And I talked about it when I talked a little bit about evidence-based practices. I'd be curious if anybody, I know there's at least one organization on this call that got a grant to do them. I'd be curious to hear from folks if you got a grant. But there are many evidence-based practices. You can see that on the slide. And each of these initiatives has a lot that are just being funded under their initiative. But what you will see is consistency of these 3 different EBPs across these 3 different initiatives: parent-child interaction therapy, multisystemic therapy, functional family therapy. Oh, sorry about your fire drill, Maria. Please, we'll connect later. Another big piece that is being talked about, particularly in foster care, is high fidelity WRAP. And you'll see that is also being discussed as part of the BH Connect initiative. But this is a way that these initiatives are working together to highlight evidence-based practices to really get organizations thinking about particular types of interventions that can be used, and move us in that direction as a field. Obviously, anybody who does or has done evidence-based practice also understands that it's challenging, right? There needs to be ongoing supports for those programs. It's expensive to train people and to keep them trained. And one of the areas of advocacy that we do on a regular basis is ask those questions, right? Okay, this is a great to do this grant program, but if you find that it's successful, how are we going to continue to support those services? Because there's just no point in doing it for a few years only to have those things drop off. So, okay, we've got a wrap-up slide, I think. Next, how you can engage. Reach out to your schools and your county offices of ed, who are very involved in and should understand what's happening with the CYBHI, learn the details, connect with your county behavioral health around BH Connect planning, learn more about the health plans in your area, and ask questions about what they're doing around dietetic care. And then for a little bit more information about a network that we have created called the Full Circle Health Network. This is an organization sort of adjacent to the Alliance and our Catalyst Center that creates a network of providers to do some of the new services that are available under CalAIM, like enhanced care management. And again, another 1.5 hour long webinar that I'm sure Full Circle would do with you if you are a provider or interested in learning more about that. But they are really trying to help create a statewide network of organizations that can support children, youth, and families. So, okay, I'm gonna stop there and say thank you all so much. Adrian, anything else to add that maybe we've forgotten?
I don't think so. I was trying to think. I put some more links in the chat in terms of like partnerships with schools. Like these are schools that are that are really active and want to do more for our kids in terms of behavioral health. So it's a good list, a good working list of partners.
Awesome. Any final questions from our audience? Thank you so much for being engaged and asking questions. It always makes these presentations a little bit more interesting. And of course, there's probably lots of questions people have that maybe weren't asked. And we encourage you to reach out to us and let us know how we can help.
Wonderful. And with that, I just want to say on behalf of the participants, thank you so much for the information that you shared. I saw in the chat people were very grateful for the information. And for participants, I always say the easiest and best way to show some appreciation, since we cannot applaud together in this virtual space, is to give your presenters a reaction. So you'll see the little reactions start to float across the screens, or virtual applause, if you will. There you go. And to the, so aside from all this incredible information that you have, don't forget there's going to be a copy of this recording, as well as some follow-up resources sent to your registration email. You can also access a copy of your certificate of attendance in the chat now. So you'll see that there's a brief survey at the end of that survey, which is about the evaluation for this training. You'll receive your certificate. And with that, we want to say thank you all so much. For those of you that have been to Caltrain before, welcome back. For those of you that were here for the first time, we hope to see you again. And we hope you have a wonderful rest of your week, everyone. Thank you so much. Have a great day.